So, welcome to discussion of examination of skeletal remains. Yes, so this is very important topic in your forensic practicals. Okay, examination of skeletal remains. So, like in your exam, the bundle of bones can be given. The question can be asked: what is the pro forma of examination of skeletal remains? How to give opinion? So, as per CBME curriculum. So, in today's session, I'm talking only about the certificate, not in detail about the practical aspects of age estimation and sex determination. Only the important lines related to examination of skeletal remains. So, as we discussed in your exam, so it carried 10 mark. So, it is a 10-mark exercise in your forensic practical as per CBME curriculum. Fine. So, let's see what is the checklist, how the marks are divided in examination of skeletal remains. Bones are given, like skull is given, pelvis is given, mandible given, sacrum. So the bone can be given. The question can be asked uh, to give opinion, the final opinion. Either it can be related to the age, sex, stature, anything that can be asked in the exam. But the standard pro forma that should contain all these lines. What are these lines? The first one, addressing IO. IO, as I discussed before, I'm talking only about the certificate. So, what should be written in your certificate? All the practical aspects like differences between male and female skull, differences between male female pelvis, male female sacrum, that you can go through in your textbook, or you can go through the recorded lectures in PW Med. So, in this 30 minutes, I'm talking about the certificate. The first component, addressing IO. What do you mean by IO? Investigating officer. How to address. And the subject and the reference, that is half mark. This line should be there. Let's see what is that line here. What we can see here in your exam, you need to write line. So, who? Police sub inspector, the police station, New Delhi police station, ITO police station. That what is the subject? Examination of skeletal remains. In short form, skeletal remains are dismembered body parts. Sometimes in forensic medicine, we do get this specimen which consists of soft tissue, muscle, so that can be dismembered body part. And the reference, for each certificate, there will be a reference, yes or no, reference from the police station, or it can be a crime number. Crime number can be, it can be a case of murder, alleged case of murder, so it is punishable under 302 IPC. So, crime number with reference to above, you need to write like this: with reference to above, with reference to above subject, and two, with reference to above, we received sealed article. Sealed article, usually we get sealed article. So it can be skull, or the bundle of bones which is sealed in a container. You need to write the date. What is the particular date you got the bundles of bones? So covering letter from police sub inspector, usually requisition letter from police station. What police station? The article was examined on date. The particular date you need to write. So usually in exam, you need to write hypothetical date and time and also the place. So when you write this, so you will get zero point 0.5 mark. Addressing IO, subject and the reference. When these lines are there properly, then it is zero point 0.5 mark. Then you need to mention details of receiving skeletal remains from the police. That is, what is the date and the time, and what are the bones you received. That is around 1 mark. Like example, you can see here, this is a skull. So you can write we received a bone, that is skull, from the police sub inspector, the police station. So that is 1 mark. Next question comes is whether it is a bone or not. You need to write whether it is a bone or not. You know, synthetic bone also resemble like a natural bone, or sometimes some wooden material, so it can resemble like bone. So when you mention this, whether it is a bone or not, or number of bones given, that is around 0.5. Again, we're discussing in detail about all this. So next, physical state and the belongs to human or animal. Who knows? The bone might be related to the animals, maybe a chimpanzee, and or monkey. So monkey bone also resemble like human bone in some aspects. So physical state, whether they are dry or soft tissue present. Depending upon that, you can give opinion about the time since in that. Getting my point? So everything, every line has a checklist as per NMC curriculum. So this line should be there. That's around 0.5 mark. Then comes is the morphological details. What do you mean by morphological details? Can anyone in the class tell me what you mean by morphological details? क्या होते हैं बताओ ये? Morphological details. We call it as big four criteria of skeletal remains. What are they? Anyone in the class? Anyone? Yes. Yes, that is age. Age. What is the age of the specimen? Sex. Male or female. Stature. Height. Probable. Then comes is the race. So these four, we call it as big four. Big four in skeletal remains. Okay? Yes. Next comes is whether it belongs to one individual or more individual, or if any injuries or any manner of separation. If anything that you can mention, around point. If it is not there, you can mention nil, nothing applicable. As you know, there is a DNA fingerprinting that can identify a particular bone belongs to a particular person. So sometimes what happens, there can be bundle of bones. One belongs to one person, other belongs to some other person, or one belongs to male, one belongs to female. Okay. Next, cause of death. Up to some extent, you can give cause of death, especially in metallic poisons or any firearm injury. You can give time since death. Again, there are methods of time since death. Finally, the opinion. Opinion you need to write properly. The given bone is human bone, belongs to male or female, probable age, probable height of the person, belongs to dash race, probable cause of death if it is time since death. If you know, you can. Otherwise, you can keep blank. Yes. So this is the checklist as per NMC curriculum. Now I'll go little one by one. I'll go what are the important uh, confusions, important lines I'm going to discuss in the next 20 minutes. So this is the checklist. And the very important component is morphological. Next is the opinion, right? Okay, this is the standard format which we use in practical classes, in our practical classes at Dubai Medical College. Use this. Okay? This is the standard format. Standard format. You can see here everything that is there here. To police sub-inspector dash police station. Subject examination of skeletal remains. Reference number and the PS means police station. Crime number under section. What is the section? Again, the with reference to above received a seal article or all these we discussed. So the first line is whether it is a bone or not. Second line, number of bones or dismembered body parts. Physical state belongs to animal or human. Morphological, that is race, sex, age, and stature. We discussed about big four, right? Just now we discussed big four. Belongs to one or more individual. Injuries or manner of separation. Cause of death, time since death, finally the opinion. Opinion along with your signature, name, and designation with the seal and date and time. So this should be a complete report. Okay. Yes. Now we're talking about one by one line, like whether it is bone or not. Sometimes they can ask question like this. So first question comes is, are they objects really bones? Are the objects really bones? So what we can see here, this is a wooden thing it is. Some wooden material resemble like bone. Sometimes there can be confusion. So, and this we can see here as synthetic one. So this is the synthetic one. Synthetic one. The question can be asked how to differentiate between a bone or not. So the answer should be precipitin test. Yes or no? Precipitin test? No, that is for the species. For bone, you need to look microanatomy. Microanatomy. When you see microanatomy of bone, you will see Haversian canal. When Haversian canals are there, osteocytes are there, then it must be bone only. Question asked, your answer should be yes, it is based on the gross skeletal anatomy. Yes, gross feature. Bone macrostructure, as you know, epiphysis, diaphysis, metaphysis, up to some extent. Then important one is the microstructure. Microstructure, when you see Haversian canal, then it must be bone only. In synthetic bone, it is absent, Haversian canal absent. In case of wooden material, Haversian canal absent. So your answer should be sir Haversian canal. As you know, histology, transverse section, bone in anatomy, that you need to answer yes. This is first question. Is it clear? Yes. Second question comes is number of bones or dismembered body parts. Sometimes there can be bundle of bones given. Yes, we received around 10, 12 bones or dismembered body parts with a soft tissue. So that you can mention. It is very simple actually. No need to worry about it. Second line is simple. The third line is physical state of the bones and dismembered body parts. So you can see here these bones are dry, no soft tissue present. So you can mention in the exam, yes, the bones received are dry. Dry. Yes or no? Dry. Are they human or animal? The next question comes is, are they human or animal? So what happens actually is sometimes animal, like example, chimpanzee bone, chimpanzee skull, or a monkey skull, or monkey bones belongs to animal resemble like human bone. Then how to differentiate between animal and human? Yes, now is the precipitin test. Precipitin test. Remember precipitin test. What is the principle of precipitation? Precipitation, we mix antigen and antibody. When antigen and antibody, when corresponding each other, there will be formation of line of precipitation. So when line of precipitation seen, it must be human only. Otherwise, it can be animal. You need to mix the antigen with the human antiserum. So the one well-known method is gel electrophoresis. That is also a good method. Gel electrophoresis. So possible with the bones, especially the plasma proteins and all. So that is up to for about 5 to 10 years. So this is the one very important line asked. Whether bone or not, our sin canal. Whether human animal, precipitin test. Yeah, that not precipitin test. Precipitin test. One very important question asked in your NEET PG also. Okay, blood stain, seminal precipitin test. All these are very important questions asked from trace evidence. So now we are moving into the next line. Okay, so this is what the precipitin test you can see here. Sometimes some examiner they can ask you what is precipitin test, explain. You need to answer antigen soluble human. So antibodies, human antiserum made from the rabbits. You can see the zone of equivalence, nothing but visible precipitate. So you can see here, this is the precipitate. So precipitate you can see here. So when you see the precipitate, precipitin, then it is human bone. So that is what you can see here. This is the animal bone, resemble like a human bone. Okay, especially this is what the line given in standard textbook that you can go through that. Next comes is the race. See, race can be, European race, Mongolian race, American race, Indian, Chinese, and race can be different. So who knows the bone that can belongs to an European who is missing from India somewhere in the Goa, and the skeleton is found. Yes. So race also need to mention. How race can be identified? By a simple answer, cephalic index. What do you mean by cephalic index? Remember, cephalic index is breadth divided by length. I'm not going to discuss in detail about cephalic index, that we can go through your theoretical. You need to take the breadth of the skull, you need to divide it by length of the skull. When you divide, you will get a value that is cephalic index. So when it is 70, 75, dolichocephalic. 75 to 80, 75 to 80, mesenterocephalic. Brachycephalic, 80 to 85. Examples you can see here in a standard textbook. Pure Aryans, 70 to 75. Mesenterocephalic, Europeans, Mongolians, 80 to 85. See, there are many other indices also, not only the cephalic index. There is something known as crural index, brachial index, tibiofemoral index, humeroradial index. There are many. Okay, nasal index. So some exam they can ask you what are the other indices which are used for race estimation. The answer should be very simple: brachial, crural, humerofemoral, intermembral, nasal. So this is very frequently asked question in Viva. You just need to know this. Okay. Yes. And Indians, according to Case and Reddy, comes under mesenterocephalic. In our practical exam, usually when we conduct practical exam in our college, we usually ask one question, standard question. No, anterior posterior diameter is maximum in. Anterior posterior diameter is maximum in. Options are dolichocephaly, mesenterocephaly, brachycephaly. This you need to answer in the comment section. Yes, anterior posterior diameter is maximum in. Okay. So if you answer, you will get distinction mark usually in the. Fine. So this is about the race. I'm not going to discuss in detail about the race, that you can go through the standard textbook. So this is what the spreading calipers. Okay. This is the spreading calipers you can see here. Sometimes the exam they can ask you what do you mean by spreading calipers. Spreading calipers and how to do that. Okay. So this is the length of the skull and this is the breadth. One easy way to understand. Next comes is the sex determination. As you know, this is a very common exercise. So very frequently asked in your exam, sex determination from the bones. So that is the next line. So what you can see here, this is the male and this is the female. So how to differentiate between male and female? Basically, it's a theoretical class. You can go through the book. But here I'm going to discuss some points. What you can see here, you can see the orbits. Orbits are, orbits are somewhat rectangular. Case of males. In case of females, it is round. Supraorbital margins are prominent. Supraorbital margins are prominent in male skull. The forehead is steeper. When you see the forehead is steep. When it is straight, it must be female. And also look at the mandible. Mandible is U-shaped. So all this you can go through the standard textbook. So this is male and this is the female. So depending upon many criteria, there are around 17 to 20 criteria given in the standard textbook. You can go through that. Okay. So this is about the sex determination. Remember, the best bone is the uh, that is for pelvis, accuracy is around 95. Next best is the skull, that is 90 percentage. Skull and pelvis around 98. Long bones, that is around 80. Remember, this is known as Krogman formula. In Viva question asks, what do you mean by Krogman formula? And you can just interpret that. So Krogman is, this is the Krogman formula. The best bone is the pelvis. Again, difference between male and female pelvis, male and female sacrum, can go through our previous classes. So that is nicely explained along with the animations, along with the videos. Right. Now we're talking about, so these are differences. You can go through the standard textbook. So male and female differences all neatly given it is. One more difference which I commonly ask, most of the muscle markings, most of the bony framework is prominent in male skull except frontal and parietal eminence which is prominent in female. This frequently asked question in NEET PG also. Now we're talking about age estimation. Again, age estimation, there are many methods. When bones are given, age estimation can be done with many methods. One simple method is teeth eruption. Teeth eruption, as you know, the molars, premolars, when they appear, and they erupt and all. You know, first molar in permanent teeth that appears at 6 years. Second molar, that is 12 years. Third molar around 17-25 years. So depending upon the teeth eruption, you can estimate the age. That is the first criteria. Second criteria, skull suture. Look at the sagittal suture. So when it is completely closure, then the age can be different. The best suture is sagittal suture. So go through the skull sutures and when it is going to close. You know? So next, ossification center for bones, especially long bones. Okay, whether they are fused, unfused. Some X-ray if it is given. X-ray also you can use. Pubic symphysis changes. One very important bone between third decade to fifth decade, that is pubic symphysis. So there are some classical changes that occur in young age and in case of middle age and in case of old age. So the best bone is pubic symphysis. Looking at the pubic symphysis, you can give opinion of the age. Then, as usual, secondary sexual characters, that is in living person, but not in skeletal remains. So look at this. One method very commonly asked in your exam is the sutures. Okay, sutures. Difficult question it is. So suture, suture, suture. This is sagittal suture. What you can see here, it is completely closed here. Complete. That means this skull basically belongs to the old age. Right? So again, skull suture, the fusion and all, you need to go through the standard textbook, the values you have to remember it. So this is completely fused. Okay, fused. Okay. And then again, this is pubic symphysis. So what are the changes in young age, middle age, and old age? So they can ask you in your exam. Remember, in old age, there are erratic ossification and irregular lipping that is seen in case of age. So what we can see here, erratic ossification and irregular lipping here. So this is the classical of old age. Okay, this pubic symphysis belongs to the old age. Some usually distinction for distinction student we ask this type of question. So nothing much required other than this. There's something known as Suke Brook classification that we can go through the standard textbook. Next comes is the height of the person. So height also can be identified or it can be estimated with a bundle of bones. I think many are aware of it. So by looking at the femur, okay, you need to measure the femur length, and that you need to multiply with 3.6 or 3.8. So that is around 27% of the height. So this is the multiplication factor. Again, it is approximate one. Then tibia fibula, the multiplication factor is 4.48. Humerus 5.3. Radius 6.7 to 6.9. Ulna 6 to 6.3. Spine, so that is not required. Skull, usually this can be asked in your exam. Skull height and multiplied by 8 that is equal to the height of the person. So the skull height is nothing but to the from the Bayesian to Brigma. So this is frequently asked question in your NEET PG also. The multiplication factor. Like example, 30 is the length of the humerus, and what is the height of the person? 30 multiplied by 5.3. So it's around 159 centimeter. So the height of the person is around 159 to 1. But again, there are some plus or minus values also for your undergraduate level. If you know this, more than sufficient. So now we're talking about one more question asked in your exam is about Hepburn osteometric. Question can be asked what are the parts of Hepburn osteometric board, and it has a fixed plate, scale, moving plate, and on. So this is the one used for estimation of length of the bones. So once you measure the length of the bone, you can estimate the height of the bone, that is basically required for what? Height or the stage. So this is frequently asked in your exam. Then comes is the next comes is the belongs to one or more individual. Again, we discussed now DNA fingerprinting is one of the best method, or by using DNA profiling we discussed. Y chromosome, that means male, or articulation. Again, age, sex, stature. There are many criteria. So the one or more individual depending upon presence of Y chromosome or DNA profiling, age of the different bones, sex, and stature. Depending upon that, you can use opinion. Next comes in any injuries. So sometimes you will see some entry wound or exit wound, probably skull case of firearm injury. So differences between entry and exit wound can be asked in your exam. So like example, inner table beveling is seen in case of entry wound, outer table beveling is seen in case of exit wound. So this can be asked in your exam. So and the manner of separation, sometime it is given, or sometime any firearm injury we discussed. Metallic poisons also you can detect. Cause of death, again, depending upon the bones, depending upon the findings. Usually, a cause of death cannot be identified in normal bones given in the exam. But in case of firearm injuries, or in case of metallic poisons, or in case of cyanide poisoning, so you can identify. So up to some extent, you can identify the poisons within the bone. Okay, time since death. Time since death. Again, the line time since death is there. So time since death, depending upon the gross examination of the bone, depending upon the status of the bone, so the presence of soft tissue or not. Sometime, if there's a fracture is there, depending upon the stage of healing, physical state, physical test, there are multiple physical chemical tests. So if they ask you an exam, one method is the nitrogen content. Okay, so nitrogen content is one of the method for time since death. As you know, bone is fresh. The nitrogen content is around 4.5, less than 100 year, around 4 percentage. Bone older than 350 years, it's 2.5 percentage. It's all depending upon the nitrogen. Right? This can be asked in Viva. One more question can be asked. Recent bone, you will see uniform layer of the hard tissue. But in case of older bone, you will see the middle hard zone, sandwich effect, loss of organic matter from outer and inner bone. So this is the older one. This is the recent one. So sandwich effect is seen in case of older bone. Time since death, again, some other criteria. When intact soft tissue is there, probably 3 weeks to 3 months. Only cartilage joint capsule is present 3 to 5 months. So this is can be asked in your exam. So this is about the examination of skeletal remains. So we discussed in brief about the examination part, especially the pro forma, as we discussed in the beginning. So this is what the pro forma. Yes, you can see here. This is the pro forma. We can see. Now you need to write. So the format. So subject, reference letter, whether bone or not, number of bones, physical status, belongs to human or animal. Morphological criteria, they are known as best pro criteria, race, sex, age, and stature. belongs to one or more individuals, injuries or manner separation, cause of death and times his death, finally the opinion and your signature, name and seal. This carry 10 mark in the practical exercise, TBME practicals. So and related all the other aspects, like example differences in male and female, age estimate, ossification, cubic symptom, and skull suture. And that's it about the today's session, the examination of skeletal remains, and wish all the best for your upcoming exam. Thank you.